All right, once again, good morning, everyone, and welcome to episode 165 of the On Air Advocate, where at the On Air Advocate, we look to provide education, support, and empowerment for all of those with different abilities, mental and medical illnesses, and their caregivers. For those of you who may not know me, my name is Tammy Flynn, and I am the host and producer of the On Air Advocate, and I am super excited if you are joining us this morning or whether you are catching this on the replay. Now, as always, if you think any of the content that we are covering this morning could be relevant for anyone in your network or your circle, please hit the share button and share the love with others. Well, as you guys know, we are in our Hope series, and I am so excited to have with me this morning not only a very passionate advocate, but Annalee Kruger. She is a family caregiver concierge. She is the president of Care Right, Inc., and she is also a senior advocate. So welcome.
Good morning, and thank you, Tammy. I can.
Thanks. There is a slight delay going on, I think, between our computer systems. So bear with us if there's a touch of that during this segment. So Annalee, I wanted you to share with the audience, if they've never heard you speak on this platform before, just a little bit about your background, a little bit about Care Right, and then we're going to kind of dive into where the title of this episode comes from. Let's put the care back in healthcare.
Very good. All right. Well, good morning, everybody. My name is Annalee Kruger. I have a company called Care Right Incorporated. I am a social worker. I've been a social worker in long-term care for over 18 years. And every day I had families in my office because there was a medical crisis. Mom fell, she broke her hip. She's the caregiver to dad with dementia. Kids didn't realize how demented their loved one was until they came home to come to the rescue and figure out where mom and dad are going to receive care. So every day I was doing tours with these families who found themselves blindsided by a crisis. The hospital will say, here's a list of facilities, go find one by noon tomorrow. And that's what happens every single time. And every single time families are just blindsided by that. So the tour would take about an hour, but I was spending 2 and 3 hours and sometimes 4 with families because of family relationships, family dynamics. A lot of families made the promise, Mom, I'll never put you in a nursing home. And here we are looking at placement in a facility. Families didn't understand if their parents had living wills, power of attorney, long-term care insurance. They had no idea about any of the planning that their parents had already done. And so in 2011, I left corporate America to start my own company and call it Care Right Incorporated. I am nationwide. I leverage Zoom to meet with families across the country so that we can talk about what's working well, what's not working well. What are the goals? What are the plans? What are the financial resources that we have to work with? And so I help them age in place at home with leveraging community resources in their area, but I also help them find those well-suited retirement communities, because even though most people want to age in place at home, the reality is that assisted livings are full of people who also wanted to age in place at home. So it's really developing that aging plan comprehensively. So what stemmed this, I should trademark that. Let's put the care back in healthcare. I did a video a couple of months ago. My parents came down from Iowa, and they were coming to stay with me for the winter. And unfortunately, my mom fell on December 2nd. And our whole family has been in a new transition in our lives since her fall. My mom has dementia, and my dad has been her caregiver for a number of years. Mm-hmm. I am in Florida, but I fly up every 5 weeks to spend about a week with my parents, just to give my dad a break and to spend time with my mom and my family that I have up there. And when I flew up in November, just like I tell all of my clients' daughters, because it's always the daughter who calls me because she's burned out, right? And so just like I tell all of my family members, my clients, I say, I can promise you things are not going as well with your parents at home as you would like to think so. Denial is a great place to be until you can't be there anymore. So I fly up in December, see that things aren't really going well, like from the month before even, they just continually go downhill. And so I said, why don't you guys just fly back with me, come a month early and fly back with me? And my dad was like, yes. So I knew that he was kind of losing his grit, right? To have that much more, 3 weeks more of caregiving by himself was just not going to be the solution for my dad. So they flew down a month early. Within a week, my mom's knee buckled and she fell. She landed in the hospital one of the hospitals in Fort Myers, and the care there was atrocious. And what I mean by that is we could not get the physicians to listen to us. We couldn't get the nurses to listen to us. My mother was literally screaming out in pain from the injury of her fall. She was screaming out in pain every waking moment, and the nurses just didn't seem to be bothered by that. And whether fortunately or unfortunately, however you want to look at it, my mom at the time was 79. She just turned 80 last week, but at the time she was 79. Because she was there for so long in the hospital, she had 4 roommates, and those roommates also had the same issues. They were in extreme amount of pain and just wasn't able to get it managed properly. So I did a video, we have to put the care back in healthcare, because my dad was spending all day with my mom, and then I would come up when I would get done with work and then stay until about midnight, 1 o'clock or 2 o'clock in the morning, because of course, like I said, my mom has dementia. And unfortunately, and I hate to say this because I'm in healthcare, I'm in the healthcare industry, but 25 years ago, when I first started in healthcare, it seemed like we did care it seems like there was a lot more care with our patients, and we advocated better for our patients. But I can tell you that I have never been so appalled at what I witnessed with my mother. So I came home one night. It was about 2:30 in the morning. I had just got home, and this is after like a 14-hour shift, if you will, at the hospital. And it was like week number 2. So my resolve was resolving. And so I did a video, and it got like 5,000 hits. And I've had over 350 families reach out to me after I did my video about we have to put the care back in healthcare. And I don't want to, I don't want to bash the healthcare industry, because there's obviously there's hundreds and thousands of people that are in healthcare that do care about their patients. But I can tell you that as a patient advocate myself, it's pathetic that I even have a business where I do patient advocacy for families. And especially after that video, when it got so much attention from people across the country, I've had hundreds of people reach out and share their story about, you're absolutely right. We had the same problem, and the nurses actually have called security on some families because the families were advocating for their loved one. So there is clearly a problem out there with our healthcare industry. And there's a few things I feel like have attributed to this issue that we're in. Is I don't want to say it's necessarily always the people, because to go into nursing, you generally want to help people. I mean, that's generally kind of the personality style or personality type of someone who goes into healthcare. Is you generally want to be an advocate and do the right thing for your patient. I think a lot of our problem, though, is our system. It's become task oriented, it's become insurance driven, and it's become less and less patient centered. And there's less and less patient advocacy. So it's the system, it's the healthcare system that we have that has to get reformed. And yeah, there are people in those positions that really shouldn't be in those positions. But I think a lot of it is just the system itself. And I can tell you from being in healthcare for so long, for now almost 30 years, our healthcare system is woefully ill prepared for the volume of patients that we have and that we are going to have, especially as these baby boomers age. Right. So even here in Florida, even though I'm, nationwide, I obviously have families here in Florida. I got a call this morning from a hospital. They have one of my patients obviously is up there, or one of my clients is up there, needs memory care, and there's not open beds,
Right.
And so we've got just such a horrible shortage
Right.
of places for these seniors to go when they're in a hospital.
Right. Right.
Even, because I know, Tammy, you're in the Wisconsin market. I built my business in the Milwaukee market.
Right.
And, part of the planning process that I do with my clients is we need to start doing tours of these communities sooner rather than later, and put your name on the waiting list of facilities, because you have to financially qualify to move into these communities. You have to physically qualify, and you have to cognitively qualify. And consumers don't always realize that. They think, well, mom can't stay at home, she needs to move into whatever facility down the street. Well, if you don't financially qualify, you can't get in there.
Right.
So, um, so it's not just a Florida thing where there's a shortage of beds, if you will, beds availability. There's facilities there in the Milwaukee market that also have a 3 to 5 year waiting list.
Right.
So when we talk about healthcare, number one, you need to have an advocate. No matter what your situation is, you have to have a family member or a paid advocate be with you at all times at the hospital. And you need to have a plan put together, because at some point the hospital is going to say, look, there's nothing more we can do for you. You don't meet insurance criteria to stay here anymore. You need to discharge tomorrow. Where are you going to go? Well, if there's no open beds, there's no open beds. So then what do you do?
Right. And
So that's why I say that's why I say it's our healthcare system is fractured, and it needs to be reformed.
Definitely. And you know what I find so interesting, actually so ironic, is that almost about 2.5 years ago, when my grandmother, I took her into the hospital for an emergency visit for being sick, and then that ended up being the next 3 months of her life. I am an advocate, a patient advocate, a community advocate, for many children as well as young adults with disabilities and different abilities. And so I had thought that I had seen the gamut of lack of this, lack of that, lack of this. And I know that the hospital, I know that the care facility didn't think that somebody that has also been doing this for 20 some years was going to be walking in with their grandmother, scrutinizing everything and really looking over what was happening. But I did. And when I took her in those next 3 months, that was my episode 2. I believe it was episode number 2 of the On Air Advocate. So we're on episode 165 now. So if you go back to that, and it wasn't even on video yet because I wasn't doing Facebook, it's just a podcast. But I broke down all of my findings as well. And Annalee, when you use the word appalled is a great word to use. I mean, you think that for kids, there is a lot more attention given, though not perfect. You still have to watch things. Then we come into kind of our middle-aged adults, and it kind of drops a little bit. But when we come to our aging loved one population, it's atrocious. And I think, just from things that, because, I do kind of analysis state to state of their different care hospitals, what is out there for young adults as well as adults. And I think that's something, and you probably have this in your planning, your aging planning with families, is that looking at states that actually have accommodation. So we look at Florida and we look at Arizona, 2 hot places to retire to. It's warm, better weather, all of that. And their level of healthcare is more focused in on the aging population because the aging population lives there. But there is so many that there is a lack. I mean, I'm saying there's just as great of a lack, and sometimes even more. So sometimes checking out where you're thinking.
And I would have to say, I would have to say, just let me interject. Let me do a shout out for Milwaukee
Mhm.
because Milwaukee is not like your retirement landing place, right? But because I even though I've lived here in Florida, I'm still in Milwaukee, and so in Milwaukee, we at least have full continuing care retirement communities that have all the gamut. We have more of them in the Milwaukee market, which is not the retirement place of the world, than we do have down here in Florida. And so the challenge is, you're fine if you only need assisted living, but God forbid you need that next level of care or you need memory care. There's not it's not a continuing care. We don't have like a lot of full continuing care retirement communities where they have all of the different levels of care that you generally need when you're in that aging journey and life,
Right.
end of life journey. And it's really shocking actually to me that in a state where so many people, it's the hot spot to retire to, we don't have the level of adult day services. We don't have the memory care programming. We don't have full continuing care retirement communities. And unfortunately, the ones that we do have, very few people, unless you're a multimillionaire, can actually afford to go in there. So your average Joe Blow from the Midwest, unless they're incredibly affluent, can't get into those places because they don't financially qualify.
Right. And because the markets are so saturated, I just spoke with a doctor here in Wisconsin that lived most of his life in the Scottsdale area in Arizona. And I had just taken a trip there recently and looking at healthcare there. So when I travel and if I travel with my son that is compromised health wise, what are doctors, what are places and facilities? And he said, even, that so many people that are aging move out there, but it's just so saturated, healthcare, and he moved back here to further his practice to the Midwest. And so, I think that people have to look at their circumstances. Obviously, as things can happen at any moment, right? Life can change in the blink of an eye. But really realizing, especially if your aging loved one has already some very compromising healthcare issues, where there's going to be facilities, because isn't it, and you can speak to this much better than I, Annalee, in Florida, isn't there kind of like even a waiting list once you move there,
Oh
waiting to see your doctor?
yeah. Oh yeah. Yeah. I mean, even
It's so interesting.
yeah. So even for like the memory care clinic to get in to get evaluated, there's 3 to 4 month waiting list or longer. And so it's we just, that's why I say we are our healthcare system across the country is woefully ill prepared. I have clients in the Milwaukee market that have special needs children, and I'm working with them as well. And just to get in to see their specialists in the Milwaukee market, it's months out. So I mean, it's everywhere, and that's that's a young child who needs to be evaluated for some issues that he's having. So I mean, it's across the board. Our healthcare system, just, we're not equipped. And I have to say, even with my mom's experience and when I'm at the hospital advocating with my local clients, I often look at their name tags and I'm like, you're an RN? Really? I just, because they don't sometimes seem to have the critical thinking skills that our RNs from 25 years ago
Right.
seem to have. And so, or because there's such a shortage of the other problem is we have an applicant pool shortage of people that you would actually want to take care of your parent, so, or your loved one. And so that's part of our problem as well, is we don't have a great applicant pool across the country, and there's less and less people to be caregivers.
Right.
Why? Because families are smaller. Back when we're healthcare in Iowa and Wisconsin, rural areas, these people had 8 and 10 kids. Well, families aren't that big anymore.
Right.
Number two, so the applicant, the families are smaller, which automatically reduces our caregiver pool. And the other thing is, not everybody is wired to be a caregiver. It's not for everyone.
Right.
And number three, it's hard work. These people are doing things that we as families don't want to do. And I can tell you that it's hard work and the pay is not great for them.
Right. And
Right. So there's just a lot of things that kind of bundle into something bad.
yes. And, I found, and I kind of advocated, I guess, for some of even the staff when my grandmother was in kind of that rehab center, transitioning over eventually to hospice care and, all of those things, is that
Yeah.
we can come down on, certified nursing assistants and CNAs and LPNs and all of that. But when we look at upper management, we look at what's paid out, and you have 9 adults that need toilet changing. Okay, toileting.
Right.
You have 9 adults on a wing, and it's only you. You know what? At the end of the day,
Right.
humanly impossible for a CNA
It is.
to get them changed. And what I always pose to people is, you need to go try it. Like, if in your life you ever have the experience
Right.
of trying to change in adults.
Right.
And many of us in the special needs world have had to change our adult children, and into the adult world. It is something that is extremely time consuming. So I look back at, those facilities, them not getting enough funding to pay out, to have more aides. And then when we talk about caregivers and the national caregiver shortage, is for you to do things outside of the box, changing adult, being with people who possibly could be combative, all of that, and you are paid less than you would make as a cashier at McDonald's. Why would you choose it? Why would you choose it?
Right.
And even in the Milwaukee
Right.
area, Wisconsin area, where we do have some of the better services, we really do, when it comes to those that are medically compromised, those with different needs. You still find the problem that, there's not enough to go around. And so you have agencies that will pay people out, but they can't find people. So
Right.
unless you bring your cousin, your mom, your in-law, that's going to help you, and they'll pay them to be a caregiver, it's not there. Because would you really put yourself in that situation, changing someone, toileting, combative, for $9 an hour, for $11 an hour, when Culver's and McDonald's are hiring at $10 to $14 an hour? Probably not. So, I mean, I feel
Right.
it's such a huge, huge issue for putting that care back into, because I think that there are people that probably were good people, but now are to the point of being burnt out in that
Well,
nursing.
they're stretched
Yeah.
thin. Absolutely. They're stretched too thin, I look, because now obviously not obviously, but what happens when you have a loved one with dementia and they have physical trauma, like my mom did with her fall, and then 2.5 weeks in a hospital setting, and in so much pain. And so what happens oftentimes is it progresses dementia to that next level, which unfortunately and very sadly it did with my mom as well. And that's why she's in memory care. And I can tell you, so one takeaway I want people to think about is, if you have a loved one that you are paying someone to take care of them,
Right.
make sure and when they are doing a good job, make sure that you tell them that they're doing a good job. Because my mom is in a memory care unit, and those staff are running constantly. They're constantly running. They've got to be just utterly exhausted at the end of their shift. And so, I constantly am telling them, or I'll leave them little thank you notes, like, thank you for taking such good care of the residents. We know that you're hustling your whole shift. I look at my mom, she's easy to take care of in some ways, but she's also demanding in some ways, because she's on fluid pills. So she has to go to the bathroom like literally every hour.
Right.
And it's not a quick, okay, let's go potty quick and then let's go. No, it's like a 20-minute process every time she has to go to the bathroom. And those are things that, if you're a family member on this podcast and you're listening to it, if you've already walked the walk, because I was her caregiver when I was her caregiver,
Right.
and I'm still her caregiver, even though she placed, but just in a different role. And it's because now I can actually just be the daughter, instead of having to take mom to the bathroom basically every 30 minutes. So make sure that you're telling those caregivers, when they are doing a good job, that how much you appreciate what they're doing, because obviously we couldn't do it ourselves. Otherwise she'd be home with me. Right.
Mhm.
So yeah, our healthcare system needs reformed. Keep the good staff that we have, praise the crap out of them, and give them raises and treat them well. But also weed out the staff that really shouldn't be in those positions anymore, and look at the administrative team. How involved are they? What kind of better outcomes could they promote within their organization, so that those families do have trust and confidence that their loved one is going to get good care. For example, I ended up having to have a 4-hour meeting with hospital administration for my mom, and that's what it took for mom to then the next day start getting the attention and the tests that she needed. So sometimes as a family, or oftentimes, unfortunately, oftentimes in our healthcare model that we have, and I call it a model because to me a system implies efficiency and effectiveness and good outcomes. So I call it a healthcare model that we have. And unfortunately, with a healthcare model that we have, you've got to go straight to the top. If you're not getting your answers at the level that you're trying to communicate, you've got to go to that next level higher. And that's the only way sometimes you can actually get results.
Right.
So don't be afraid to advocate hard for your loved one. Don't be afraid to do that, because that's what it takes. That's what you have to do as a family member, is make sure that your loved one who's compromised in whatever way gets the best care that they possibly can.
Yes, I always say when someone is admitted, you need to be all eyes on the staff, like all eyes on them. When you're going in wide open and you're showing up at all different times, somebody is staying there, but it's always rotating. Because then in that beginning phase, you can really tell if they know and they don't know when you're coming, you're there all the time, you're in, you're out, and they still are lacking in care. You know what I'm saying? You really know how compromised the facility that you are in is. And, Annalee, I
Right.
over the time that I've known you as well, on a podcast we did quite a bit ago, we talked about being aware of your aging loved ones or those that have like dementia and things, to look, are their clothes clean when you come in? Have they been toileted? Does it look like their sheets were changed? Do they have stuff left on their face? Is there food in their wheelchair? That really will tell you at the level of care that they are getting for maybe those moments that you're not there, to give you even, more fuel
Right.
as you're advocating.
Right. Right.
So this is so needed, and I know that in our 30 minutes or 35 minutes we can't solve all things, but it takes, right, it just takes one spark of everybody continuing to,
Yeah.
light the next candle and continuing to use their voices, advocating for change, within, all of
Hmm.
us. And so, Annalee, if folks want to find you, reach out to you, share their story with you, any of those things, where is the best place for them to do that?
They can actually reach out to me on my website on the Contact Us page. That's www.carerightinc.com, and that's CARERIGHTINC.com, to learn more about aging planning, the grab and go binder, getting all their documents in order, and having the family meeting. But
Right.
also, if they want to reach out and share their story, they can certainly do that. When I posted the video that I did, I put it on Facebook and LinkedIn, and my accounts were just like totally flooded. I had all of these messages. I couldn't even get back to everybody so very quickly, because I obviously have to run my business as well and take care of my parents. So that's really a good way to reach out to me. And I also gave you the LinkedIn. I think I gave you the LinkedIn and the Facebook links as well, if you want to reach out on LinkedIn or Facebook as well. So.
Okay, and maybe after we're done with this segment, if later on today or when you get the opportunity, you can just drop below in the comments of this Facebook video, where all those sites are. So, people, it's just easier to click to. That would be
Yeah.
awesome.
Yep.
That would be awesome. And, would love, at some point in time, um, it'd be wonderful to put together all of those stories and those things that you're hearing,
I
really
know.
move them forward. as we go to like a legislature and the Senate and talking about change and all of that. I think that, you know, the more people's voices we're hearing, and sometimes their voices are through writing, you know, not obviously always being, you know, on a show or being at the Capitol, you know, doing that. I think that that would be so powerful.
Well, and one of the people, you never know where a 2-minute video at 2:30 in the morning is going to land, and it landed on the LinkedIn page of someone who my next afternoon is she wants to do a documentary about the healthcare system and my experience, and then some of these other stories that have come out since I did my video as well. So you know, it's something that hits home to a lot of people across the country, and it's a good wake-up call that if you are ill and end up in the hospital or need care that's not provided by your family, you need to know what you're getting yourself into and have supports in place along the way, and try to work as a team with your care providers. It's not an adversarial relationship. It's, hey, you know what? It takes a village. We always say it takes a village to raise a child, but I'm here to tell you it takes a village to manage the care of an aging loved one as well. So working as a team approach and saying, look, you know, but also understanding that you're there as an advocate, but you also want to work as a team.
Right, right, exactly. Well, excited to hear where that takes you, and definitely the more information and all of that you got. Would love to have you back on this show and really break and fragment this into other areas. Those other episodes come up where we can really dive in for like one full hour on one topic. Because as we know, when we talk about healthcare, there's hundreds of different
pretty broad
little topics that need to be dealt with. This isn't just one thing that's going to solve everything. It's all those tiny parts and trying to put them together and really have conversation about them. So I thank you so much, Annalee, for taking out 40 minutes or so this morning to chat with us. And you're going to drop those links below. So if you guys want to reach out to Annalee, all of her information will be on this page, as well as the podcast, as well as the YouTube video and all of that. So with that, thank you very much, Annalee.
Thank you, Tammy.
And if you guys want to know any more about all of the resources that the On Air Advocate has to offer, you guys can head on over to onairadvocate.com, and you can find all of those right there. If you want to become part of our private On Air Advocate community, head up to the top of this Facebook page, hit the blue button, and that will let you into our Facebook group. So on that note, everybody have a terrific, terrific Tuesday. Thank you so much, Annalee. We will see you guys soon, actually tomorrow morning, to continue our Hope series. Thanks again. Bye-bye.
Bye.